We are looking at something called the curve beam. It looks like it's right out of science fiction. Dr. Joseph McGinley, orthopedic guy to the stars. Okay, so tell us what we're looking at.
Thanks, Mark. You're looking at the future of scanning for orthopedic patients. This is the curve beam CT. It's the second in the world on site in a clinical location. And what we're using this for is essentially to scan patients in a standing natural position. Now that might seem like, who cares, right? But now,
but you're thinking you're hurt. How am I standing and doing this? But you're saying
that's right. You have to simulate the problem. Right now, when you go to get scanned, you're lying down flat on the scanner. Things usually feel pretty good when you're laying down. What this scanner does is simulate the normal physiology. It shows how your biomechanics actually work. So we have the patient stand into the machine, and then the machine scans up over them and can get them all the way from the hips all the way down to the feet. It's pretty easy and simple to use. Patients come and check in. We open the door. They will step into the scanner. Once we get everything set up, we'll get the door closed. They'll lean against these rails, and then the machine will scan right up over them. We'll see everything from hips down to the feet. What this is great for is identifying problems before they occur, or if there is a problem, it helps us to better assess that issue and get them treated in a more expedited manner.
All right, let's go back over to the fact that there's 2 of these in the world.
Well, there's more now, but we were the second site. So we've
second
had this
site in the entire world,
right here in
Casper, Wyoming.
That's right.
To get this thing, and the advantage is so many things, but I mean, first of all, less radiation.
Less radiation, that's right. This scanner has 1/10 of the dose of a normal CT scanner. It's great for kids. It's great for younger athletic individuals that are trying to reduce exposure. And like I said, perfect for assessing the joints and lower extremities.
All right, so let's get back to that whole thing about your positioning being a better feeling for what's wrong with you.
Yeah, that's absolutely right. Like I said, right now, if you're an athlete, the problem usually occurs when you're doing that particular sport or activity. It could be hiking up the mountain, it could be running. Even if you're not an athlete, if you're just trying to get in shape and go outside and exercise, when you're sitting in the chair or laying in bed, it might not hurt. But then when you get up and start moving around, your ankles, knees, hips might actually be problematic. That's physiologic. That's because your whole body weight are on those joints. So if you want to assess that, you have to recreate that particular situation. So right now, if you went and got a CT scan, you'd be lying completely flat on the scanner, and then the table would move in and you would get scanned in whatever area.
So let's walk around this thing. The deal about predicting where you might have problems,
that's right,
is pretty outrageous.
Well, I know it, and you can see they have everything marked and centered down within this machine, and that's to make sure that you have perfect alignment of the extremities when you're scanning them. And what you're trying to do is recreate the normal body loading. When we walk around, the forces on our joints are significantly different than when we're sitting in a chair or in a bed. So we're trying to replicate that as best possible so we get a better, accurate diagnosis.
All right, so now you're doing a study on this thing? This is why this $300 deal come in here and get checked out?
Well, we are doing some research studies, but this is clinically available. It's covered by insurance if you have.
So if you have problems running and
absolutely.
You wonder whether it's your feet or maybe some place on your body.
That's right. Yeah, it'll scan the arms as well, so we can bring this up and turn it and scan the arms. So that's all covered by insurance, but we're taking that a step forward. We're saying, how can we push the envelope on this and try to help athletes before they're actually injured? So we started a biomechanic assessment screening program, and with that, someone can come in and it's $300 cash pay. They can even walk in and do it. It takes about maybe 15 minutes or so, and we'll get you scanned and see if there's any issues before the problem actually occurs.
You're probably going to be seeing some world-class athletes coming in here. Dr. McGinley, this is amazing. How about we do another spot on this, okay?
Perfect. Thanks, Mark.